Rickets. Rickets is a disease of growing bone. It is derived from the word rickets, meaning twisted, referring to the characteristic bony deformities of the bow legs of rickets. The most common cause of rickets is nutritional deficiency of vitamin A. That's the most common cause. Apart from that, low calcium, low phosphate levels can also cause it in the diet. So, dietary deficiency of calcium and phosphorus. Pathophysiology, vitamin D deficiency is causing. So the basic use of vitamin D is to increase the calcium level in the serum. So in case vitamin D is deficient, vitamin D is not capable of increasing the serum calcium level because it is not present. Okay, so what happens is the PTH kicks in. So the PTH, the parathyroid hormone, is going to increase. The parathyroid will increase. So because the PTH is going to get elevated, the osteoclastic activity of the bone is going to get increased, and that in turn is going to cause increase in the calcium resorption from the bone. And as a result of which the blood calcium level will be restored to normal. And but what happens is that PTH is also going to cause phosphate loss in the kidney, so phosphate level is going to get reduced. So this is what happens in case of vitamin D deficiency rickets. All right, so under normal conditions, what happens is that the growth plate, which is cartilaginous, it undergoes mineralization by enchondral calcification. In this process, the chondrocytes will hypertrophy and then undergo apoptosis followed by mineralization. So for this purpose, what we need is phosphate. Phosphate is needed to kill the chondrocytes. So it's like a flow chart, like a sequential event. Initially, it is undergoing calcification. Okay. Second, it's going to undergo hypertrophy. Third, is going to undergo apoptosis, and after that only, okay, mineralization. So what happens is, first there will be hypertrophy of the chondrocytes. Second, after growing, it's going to die. So it undergoes apoptosis, the programmed cell death. After that, it undergoes mineralization. So yeah, so this is what happens. So basically, the dead chondrocyte forms the bone. That's the basic thing. So adequate amount of phosphate is needed for the killing of chondrocytes. In the absence of phosphate, the chondrocytes continue to hypertrophy. And then because there is hypertrophy in the growth plate, there's characteristic swelling in the growth plate. So we'll be seeing like fraying, splaying and all. Mineralization of the bone is also decreased due to osteomalacia and bending of the weight-bearing bones. And then osteomalacia and osteoporosis are different. Osteoporosis is proportionate loss of bone. Both the osteoid matrix and the mineral content is going to reduce, and that is mainly because of corticosteroid usage. Nutritional rickets is very common because vitamin D deficiency is going to be common because breast milk does not have any vitamin D. Vitamin D is a sunshine vitamin, so like only in case of the child is going well, playing in the sun, it's going to be okay. Otherwise, deficiency will be precipitated by malabsorption or chronic liver disease, use of anticonvulsant or anti-TB medications. And then clinical features. From head to toe, there will be craniotomies, otherwise called the soft skull bones, delayed closure of the anterior fontanelle, frontal bossing. So, can be remembered by the mnemonic FDC. What is FDC? I don't know, Federation Council. Okay, F stands for frontal bossing. D is delayed closure of the anterior fontanelle. C is craniotobies. Apart from that, so that's that's about the thing in the face, about like the top of the face, which is the head. And then moving out of the mouth, there is delayed dentition. We look at the chest, there will be beaded anterior costochondral junction, which is otherwise called the rachitic rosary. So we have to differentiate this from scorbutic rosary, and thus scorbutic rosary is more painful. And then Harrison sulcus, and then swelling of the wrist and the ankles, and then deformities like knock knees and bow legs. And then, so apart from that, other features of rickets can also be there. For example, hypocalcemic seizures, muscle weakness, hypotonia, failure to thrive, irritability because of bone pain. So there's also increased risk of fracture with minimal amount of trauma. Evaluation, calcium level may be normal, may be reduced. Phosphate level is always reduced because the PTH mediated phosphate excretion. Alkaline phosphatase is high because the resorption is happening. X-ray, the first change is fraying of the bones, which is a normal zone of provisional calcification. Second is cupping and splaying will be there. Cupping is nothing but the widening of the growth plate. Splaying is widening of the metaphyseal ends. Bowing, weight bearing and stress of uncalcified bone. Okay. And then osteopenia. Management is by Strauss therapy. Thank you.